Hello, everyone. I am Deanne Mazzochi, your state representative representing the Illinois 47th District. We've organized this webinar tonight to provide an update to district residents on the process of COVID vaccine distribution in DuPage County to date. Although we know that there are vaccines available, and fortunately, FDA is actually on pace to approve more, there still is a lot of uncertainty regarding the availability. So to give an example, I've gotten calls to my office relating to directions on how can they register for appointments to receive the vaccine, who is eligible. Once you do register, how long do you have to wait before you could potentially get the vaccine? We've heard complaints that there are people who are still in phase 1A who feel like they're getting jumped in line by people who are in different phase and eligibility considerations. So what I wanted to do is invite experts from the DuPage County Health Department to answer some of those questions for you. Give an overview of what we know so far about the process, discuss where DuPage County stands in terms of inoculation, and to try to provide residents with the opportunity to ask questions as well following the panel's presentation. So in connection with the questions, we thank everyone who has already called into the office or sent us some questions either through Facebook or by email. We do have a Q&A here box in connection with the Zoom presentation. You can also put questions into the comment sections for Facebook Live, and we'll try to have our panel experts answer as many of those for you as we possibly can over the course of the next hour. Again, please do keep in mind that there are some limitations in a webinar format. There's time constraints, but we do want to make sure that we can try to answer your questions, and anything we can't get to tonight, my office will also follow up with you as well. So with that, I would like to introduce our panel experts. So first we have Karen Ayala, who is the Executive Director of the DuPage County Health Department. We have Dennis Brennan, who is the External Affairs Manager for the DuPage County Health Department. And we also have District Resident Dr. Lanny Wilson, who is both a board certified physician, Vice President of the DuPage County Board of Health, and the Chairman for the Governmental Affairs of the DuPage County Medical Society. So welcome to our panel of experts, and thank you so much for joining us. Karen, if I may, I'd love to start with you. So currently we're in phase 1A. In theory, about to go into phase 1B for vaccine eligibility. Can you give us an overview of how DuPage County is managing its own supplies of the vaccine?
Sure. And for that, I'd like to just run through a couple slides, and Chris Hoff, our Director of Community Health, has joined me. So Chris, if you could kick us off with some slides, perhaps skipping some of the introductory and going right to the distribution. That would be great.
Absolutely. Thanks. And thanks again for the opportunity to provide an update to you and give you a little bit of sense of how things are going in DuPage. Probably most important, how things are going, how we're handling supply. It's a little bit different than you might expect. I think historically we've used mass vaccination sites to really drive vaccine for public health emergencies. All the way back to polio, as recent as H1N1, we've seen these big community-based sites. Right now, we're really focused on expanding the number of sites that are available to people at clinics, at retail pharmacies, at hospitals, really trying to get that supply to as many providers as possible to ensure that people have the ability to get vaccine in those settings. The supply that we are getting is extremely limited, and the groups that we're trying to vaccinate are very big. DuPage County is about 1 million residents overall. We're in that phase 1B group. We're starting that phase 1B, as Representative Mazzochi mentioned. We're projecting right now that it could take up to 12 weeks to get everyone in the phase 1B group vaccinated based on the very limited supply of vaccine that we're getting. It's not that we don't have the capacity. We have lots of providers ready to go. This week we had 53 providers request 53,000 doses of vaccine. And what the vaccine supply that we are getting in DuPage County this week is 2,450 doses. So really an incredible mismatch right now of vaccine that is available against the number of people that we need and want to be able to vaccinate as quickly as possible. Hoping to help educate everybody about the process to get vaccine out and how we're handling the limited supply that we are getting. But it will take time, and we will ultimately have the ability to vaccinate everybody that wants to be vaccinated against COVID-19. The Part B expansion, I think, is maybe a question that we'll get. Last week, the governor announced an expansion of the Phase 1B group. So already we had projected about 270,000 people in the 1B category. With the announcement last week that an additional group of people between 16 and 64 with underlying conditions or people with disabilities could be included. That's another 174,000 people in DuPage County. Again, the vaccine supply is in no way in any kind of match to those number of people. So we're really focused on the existing population of 1B and look to move on as fast as we can as that vaccine supply goes up. In terms of where to get vaccines, so again, so the supply is coming in, where does it go? In DuPage, our strategy has really been to build up a network of providers in all of these different sectors. So again, not just mass vaccination clinics in a high school gymnasium, but really working with our hospitals, our health systems, our pharmacies, our employers. The health department is one of these sites. And as of yesterday, we had 109 providers that had been approved by the state to receive and administer vaccines. So we're really excited that when vaccine supply goes up, we have the ability to push out tens of thousands of doses every single week and move as fast as vaccine supply allows. Those providers are all over the county. So I think one of the concerns I know we hear is that, it doesn't seem like there's that many sites out there. These 109 sites are scattered across the county. Not all of them are getting vaccine yet. But as that supply increases, all of these providers will be getting vaccine supply either from us or the state to make available to people. And Karen, I think I'm gonna hand it over to you for this slide.
Okay, thanks so much. And you will see that our allocation, we receive a weekly allocation from the Illinois Department of Public Health, as Chris mentioned on a prior slide. The doses emanate from the federal government. Then the states are provided an allocation. The states then break it down. Each of these weeks, you'll see the allocation that we have received. It is an allocation, not an order. As Chris also indicated, we would like to have many, many more doses. Again, this shows how this operates. We have only had a 1 week glimpse into what our allocation is going to be up until this past week. Unfortunately, the 3 weeks that we are looking forward to, it appears that our vaccine allocation will remain very, very limited around that 2,450 to 5,000 number. So we are using some considerations when we allocate our vaccine. I'll pass over that because I think the most important thing and how we're handling this distribution is our goal in DuPage, and each county has a individual kind of approach to vaccine distribution. But our goal in DuPage is to make it just as convenient as possible, which may sound a little bit ridiculous given all of the work that has to be done right now to access a vaccine. But as Chris indicated, as the supply increases, you'll be able to get the vaccine either at our clinic or at your doctor's office or at a pharmacy around the corner. We reached 100,000 doses of vaccine going into our community's arms. And again, just a reminder, vaccines don't save lives, vaccination saves lives. We are leading our Collier County partners. And so even with the challenges that we have faced, we still are nearing the 4% threshold of having our residents fully vaccinated. A couple things to do, and maybe we'll come back to these, Chris, but for now, I think that gets us started on how we're handling distribution. Oops, can't hear you.
Thank you, Karen. I know there's a lot of questions that are popping up in the question and answer session, so we're going to try to get to those as we go along, but we're also going to save a lot of those for the end as well, just to make sure that we're sharing all the questions with everyone who may not necessarily be watching on Zoom. Maybe they're on Facebook, so that we can get those answers out to as many people as possible. So now I'd like to turn the floor over to Dennis. Dennis, do you think you you announced last week, I think, that there was an expansion of the vaccination site in Wheaton. So can you tell us what residents can expect at the Wheaton facility, and just walk us through what DuPage County is planning for the registration process?
Yeah, we can, there's registration online, and we've had that ongoing now for almost 2 months, I suppose. The new vaccination site, we were vaccinating at our central office. We moved it out to the fairgrounds. And when you have an appointment set up through our website, you'll get a date that you're supposed to show up there with it's basically a sheet that has all your information. So it's easy to sign in. We keep people set to those times. So when they pull up into the fairgrounds, there's volunteers outside. There's also employees of the department who direct people where to park, what building to go into. Inside, we have it set up where we line people up, socially distancing them, making sure that they're checked in at different tables. And then as they move from there, they wait a short time before the nursing staff, depending on which vaccine there might be, tells them to come over. If it's your first dose or second, they know that by the card you have. You're vaccinated very quickly. They are then moved into a separate area in the fairgrounds. It's the same building where they're monitored for 15 minutes. And if it's the first dose, they'll make their second appointment at that time before they leave. And then if everything's gone well, after those 15 minutes, they check out and leave.
Yeah, and I would like to just point out that the whole process should take start to finish 30 minutes or less. So we really work to get people through that clinic just as quickly and efficiently as possible.
Yeah, and Dennis and Karen, how are you handling the issues? So one of the things that's obviously very critical with the current vaccine supplies is that they have to be maintained at extraordinarily low temperatures and can only be thawed for about 30 minutes or so before you start running a risk that they're gonna there's a limited window in which you can actually administer the vaccine in between that cold storage thaw and that type of thing. How are you dealing with that logistically?
So we've moved much of our operations, as Dennis had pointed out, including freezers, our ultra cold freezers. We have freezers by the individual vaccinators where they actually provide the vaccination so that cold chain is maintained. The only thing worse than no vaccine is a vaccine that's not going to work because we haven't managed it properly. So we're doing everything we possibly can to make that a reality.
Thank you for that. All right, so now if I may, I'd like to turn the floor over to Dr. Wilson, if he could go through some of the concerns that residents might have about the vaccine, side effects, and what you've seen to date in connection with the Moderna and Pfizer vaccines, understanding that the J&J vaccine is hopefully going to come online pretty soon.
Thank you so much for this invitation, Representative Mazzochi. I'm proud to be one of your constituents, and these kinds of events make me even prouder to have you as my representative. It's always a pleasure to be with Executive Director Ayala. She has incredible information, Mr. Brennan, and also Mr. Huff. I'm a retired physician, as you know. I practice obstetrics and gynecology, so immunology is not my forte, but I'll have quite a bit of information for you based upon my years at the health department. I, by the way, had my vaccine since I'm a healthcare personnel at the health department, and it was just as they described. It's a wonderful place. Proud to be a part of it. Prior to being with you, I was given 9 questions that Mary Maris with your office had prepared, and I think you did, and maybe these come from some of your constituents as well. So I'm going to base my short talk on those questions. The first question was, what are some of the side effects associated with the vaccines? Currently, the 2 available vaccines for COVID-19 or the coronavirus disease of 2019 are the Pfizer vaccine and the Moderna vaccine. Since they are both messenger RNA vaccines, their side effects are very similar and include injection site discomfort, myalgia, which is muscle pain, arthralgia, which is joint pain, low-grade fever, fatigue, headache, chills, malaise, that's that general feeling of discomfort. These are a little bit more likely to occur after the second injection, and it's standard practice, as Executive Director Ayala said, to keep people about 15 minutes after the injection to monitor for more serious side effects. About 2 out of 1 million will get some kind of a more serious anaphylactic reaction. So we keep people there just to make sure that they won't be one of those rare people that won the jackpot. Signs and symptoms which are unlikely to be from the COVID-19 vaccination include cough, shortness of breath, rhinorrhea, which is runny nose, sore throat, loss of taste or loss of smell. If these occur, one should contact their physician for the possibility that these symptoms are related to a viral illness such as COVID-19, unrelated to the vaccination. Second question, a Johnson & Johnson vaccine may be approved in the next few weeks. How does it compare to the 2 known vaccines, Pfizer and Moderna? Unlike the newer messenger RNA vaccines, the J&J vaccine is made with a technique similar to the vaccines that were used for the Ebola virus, maybe kind of similar, more similar to the flu vaccines as well, using a weakened common cold virus that cannot replicate, but can still get into the target cell and cause it to make a protein, starting the immune response that creates antibodies. So a little different reaction, but the endpoint is the same. The J&J version is a 1-dose vaccine as opposed to the 2-dose regimens with the Pfizer and Moderna. It can be stored also in a normal refrigerator for up to 3 months. The Moderna vaccine must be shipped at -4 degrees Fahrenheit, a standard refrigerator freezer, and the Pfizer vaccine must be shipped at -94 degrees Fahrenheit in a special ultra-cool freezer, which you alluded to earlier. While the Pfizer and Moderna vaccines reported 95% to 94.1% of efficacy, respectively, 2 weeks after the second dose is completed, the J&J said their single-shot dose is 72% effective in the US studies. But the company goes on to say that their single-shot dose is 85% effective overall against those more serious symptoms and demonstrated complete protection against COVID-19 related hospitalization and death 28 days after vaccination. So it's going to be a real player, especially since it's a 1 dose, can be stored in a refrigerator. And when you look at the big picture, very similar to the 2 RNA vaccines. Number 3, do those who have developed COVID-19 antibodies need to get a vaccine? Yes, sorry, even those who have had COVID-19 have developed antibodies should be vaccinated once they are recovered. We do not yet know how long the immune response to natural infection lasts, but we do know that the vaccines have been shown to be effective in preventing infections. If somebody is acutely infected, they should wait until they've recovered to receive the vaccine. If someone has recently been exposed to the vaccine as in quarantine, they should wait until the end of the quarantine to be vaccinated in order to avoid potential exposure to healthcare workers. Next question, how long are the vaccines effective? We won't know how long immunity lasts after vaccination until we have more data on how well the COVID-19 vaccines work in real-world conditions. Experts are working to learn more about natural immunity and vaccine-induced immunity. The CDC will keep the public informed as new evidence becomes available. Next question, will people possibly have to get the vaccine each year, much like the flu shot, or could it be like the measles vaccine, where you just need to get inoculated once? You know, it's so nice of you to provide these questions for me. It was like doing an open book test, so I can kind of look up some of these answers along the way. Years of research go into figuring out how long vaccines protect against certain pathogens. This novel coronavirus is still so new that researchers will have to monitor people for an extended period of time to determine how long protection from the vaccine will last. Because of the mutant strains, we talked about this before we started our talk here, which are developing new vaccines, will probably need to be engineered to fight against those more effectively. As it turns out, the messenger RNA vaccines produced by Pfizer and Moderna are well suited for modification to fight the mutant strains if booster vaccines are deemed necessary, which looks like they probably will be. Number 6, should pregnant women wait to get the vaccine until after delivery? This discussion is near and dear to my heart, being a retired OB-GYN. There's no evidence suggesting risk from messenger RNA vaccines in pregnant or lactating women, but no long-term safety and efficacy studies have yet been published. I just listened to a webinar yesterday featuring 2 of the most respected OB-GYNs in the country, and they both bemoaned the fact that pregnant and lactating women were excluded from the original studies of the vaccine. So we don't have that information. So we have to kind of make it up along the way. We have to decide the risk-benefit ratios. According to the American College of OB-GYN, the COVID-19 vaccine should not be withheld from pregnant women who meet criteria for vaccination. Presently, Americans in phase 1A and 1B are being vaccinated, so any pregnant woman who is a healthcare worker, that's in the phase 1A, should be offered a vaccination because of her increased risk of exposure to the virus. Most of the doctors that I know, women doctors, pregnant or otherwise, nurses, are stepping up and getting the vaccine. The recommended considerations for vaccinating a pregnant woman against COVID-19 include the level of community transmission and her own personal risk. Certainly if she has diabetes, hypertension, some of those pre-existing conditions, she's at increased risk. If a pregnant woman gets COVID-19, she's at increased risk of serious side effects, including death, premature birth, and stillbirth. The vaccine should also be offered to lactating women. What is the recommended age span for the vaccine? That was an easy one. The Pfizer vaccine has been approved for anyone from 16 years and older. The Moderna vaccine, J&J vaccine, have been studied from 18 years and older. Last Friday, the South African strain of the virus was detected in Illinois for the first time. How effective are the existing vaccines against the new strains? These emerging coronavirus variants could lead to a spring surge as they're coming to our shores if people don't continue to protect themselves and use the public health measures that we've been talking about: masking, distancing, washing. In addition to the South African strain, other mutant strains include those from the United Kingdom, Brazil, and California. There may be other homegrown strains out there that we haven't even discovered yet. In isolated reports, multiple mutant strains have occurred in people with compromised immune systems, mutant strains in one body. The more often the virus replicates, the more opportunity it has to mutate. While the Moderna and Pfizer vaccines appear to be protective against the new variants, they may be somewhat less effective against the South African strain, but still have adequate neutralizing antibody levels from what we are hearing. However, we're still waiting on more data. We don't want to allow the variants to continue to propagate. The best way to prevent propagation is to get all Americans vaccinated sooner rather than later. The original timetable was to fully vaccinate the American people by the fall, but this may not be good enough. We need to accelerate the vaccination, even though you can see we're not getting vaccines. We're ready for it when they deliver it to us, and we're promised that somewhere along the way, millions of doses are going to be out there, but we've got to accelerate that. It's a challenge, but that's where the additional vaccines come into play, such as the J&J vaccine that we talked about, the ones produced by AstraZeneca, Oxford, the Novavax, and even a vaccine that's coming in from India. Next question, final question. As more people get vaccinated, how important is it to continue wearing masks and social distancing? It's very important to continue wearing masks, watching our distance and washing. This is a great question because many people in public health are concerned that vaccinated people will stop wearing masks and social distancing which in turn could have the undesired effect that unvaccinated people will also stop wearing masks. If that happens, infections and deaths are going to soar. To help contain the spread of the coronavirus variants, while people wait their turn to get vaccinated, people are turning to double masking. You're probably hearing about that quite a bit. What physicians should consider telling patients is the best mask is a well-fitted 2 or 3 layer mask, or keep the mask you're using and double mask when you go to the store or find yourself spending time with people outside of your household. In summary, we should immediately be more aggressive about mask wearing and social distancing because of the new virus variants. Number 2, we should vaccinate people as rapidly as possible, which will require approving other COVID vaccines when the data justifies it. Number 3, people who have received both of their vaccine shots and have waited until they take effect will be able to do things that unvaccinated people cannot, at least in private, like having meals together and hugging their grandchildren. Finally, until the pandemic is defeated, all Americans should wear masks in public, help unvaccinated people stay safe, and contribute to a shared national project of saving every possible life. Thank you very much.
Thank you, Dr. Wilson. I appreciate that. So now, if I may, I'd like to start pulling together some of the questions that have come in as we've been going along. So, Karen, maybe one of the first questions that seems to be on everyone's mind is, where does DuPage County stand when compared to the surrounding counties, and what we can expect in the future in terms of getting more vaccine supply into the county? Who's in control of that? Who's directing all of that at either the federal or state level?
Sure. So as we showed on that graph, DuPage County actually has the highest rate of any collar county, and in fact, we're over at this point. We're over even the state rate of individuals vaccinated within DuPage County. So, in spite of the fact that we have very limited supply, we are effective in getting the vaccine distributed and administered. It is a bit of, it is the under the purview of IDPH, Illinois Department of Public Health. They provide the allocation for the vaccines that are received from the federal government on a weekly basis. We understand that the allocation decision is based, at least in part, on population size. However, it does appear that there's other elements, and we're still working on determining and getting that information so that we can best advocate for additional vaccine to come to DuPage County.
Yeah, and from some of the governor's prior pronouncements in IDPH, for example, the governor is trying to focus on what he's referred to as equity communities. There was an executive order that came out where he included legislators in one of the preferred categories. I refuse to be put ahead of line relative to anyone else, because I'm not in a high risk group, all things considered. And to me, I'm not jumping the line ahead of anyone else who is far more deserving in terms of being an essential worker. Or over the age of 65. So there are decisions that are being made by the Pritzker administration and IDPH. It's just, for the most part, he's not giving legislators insight as to exactly what it is he's doing. And the problem is that the metrics in the allocation system it's not transparent. It does seem to change with certain whims, shall we say. But we also do know that there have been at least some successes when it comes to what was happening at the federal level. I did a Zoom call recently with some people from our long-term care facilities in the area. So I believe, for example, Park Place of Elmhurst, I think they were going to have a celebratory event because they are on the verge of getting every single one of their residents in the long-term care facility vaccinated. So that's obviously a huge value to them. And I have heard from at least our long-term care facilities who are participating in the federal CARES program that they do seem to be getting vaccines distributed into those locations. However, for people who are over the age of 65 or in 1A, but maybe who, they live at home or something along those lines, those are individuals who are much more vulnerable in the sense of they really do have to rely on either DuPage County or their existing medical providers to hopefully get the vaccine, to get them vaccinated. One of the questions that we got is, I am a category 1B as an essential worker for a vaccine. It seems like a long time before I'm going to be able to get the vaccine. How can I be assured that others are not jumping over me in my phase 1B group? Karen, I don't know if you, or Dennis, I don't know if you want to address that one.
Sure. So although we have not come out with a formal statement at the DuPage County Health Department, we are committed to making sure that we work our way through the original 1B population. They are in 1B because they do have a higher risk of contracting the virus, as well as severe outcomes as a result of the virus. And so they're in that category for a reason. So we are allowing people in the 1C category to, or now it's being called the 1B Part 2 category, which is even more confusing. We're allowing them to sign up. But we are making sure that we reach out first to individuals who may be even healthcare providers who haven't had access to a shot yet, or seniors and those frontline essential workers.
Another question that we've gotten is, our healthcare providers such as DuPage Medical Group or other private groups, pharmacies, I know Jewel Osco, CVS, Walgreens, they've all been participating. Are they also receiving and distributing vaccines? So the answer is definitely yes, but I'll let Karen jump in terms of some of the details for those.
Sure. So we primarily work with our hospital systems and our outpatient healthcare providers to distribute vaccine that we receive through the local health department. There is an allocation, and we learned today that there's an allocation of nearly 5,000 doses that is provided to, on a weekly basis, to Jewel Osco stores within DuPage County. We've been asking for that information for many, many weeks, and finally we're able to get that information today. That is outside of our allocation and our distribution effort.
And again, this is a common theme among some of the questions that have come in is, while we understand that DuPage County plans on prioritizing the 1A, 1B category, but we know that the expansion is going to mean more people are trying to get appointments. More people are, it expands the scope of potential disabilities and that type of thing. And I've also gotten, confirmation from district residents as well that, maybe they were in that category and they're not in a long-term care facility. They are over the age of 75, and they basically got online with Walgreens and Osco and those every day, and just hope to get an appointment that was set up, and maybe through luck of the draw they finally managed to get an appointment. So is there anything that you want to further add on onto those types of issues that that people are facing?
No, I think it is unfortunate that that decision was made at exactly, or announced exactly the same time that our vaccine allocation plummeted. I think that that's one of the primary concerns that that increases people's anxiety, that raises people's frustration, is they know they're at high risk and yet they cannot access the vaccine. And so absolutely, I understand that, yes, it has created a bigger pool. How we're managing the list of registrations that we collect both on our website, which Chris provided a link in the chat, as well as individuals who may not be computer savvy or may not have internet access or may need a different language other than English to get questions answered and to register, are certainly encouraged to call between 8 and 4:30. We've contracted with an external call center, and you can call our main number, which is 630-682-7400. And these individual call center representatives will be able to address your questions and help fill out that registration form. Then we work our way through the registrations, and based upon date of registration as well as eligibility, we will be calling people off that list to then offer them appointments.
Karen, if you could talk a little bit, or Dennis, if you could, or Chris, if you could talk a little bit about what about those individuals? Maybe they've got a physical disability, but there's also a big community in DuPage that has intellectual or developmental disabilities as well. Again, I know some of the long-term care or group home settings have really been trying to vaccinate those members, but what about, again, for the more general population? And is there going to be any documentation required in connection with, identifying disabilities?
And Chris, yes, I'll.
Yeah, so it's a great question. We expect a little bit more information from the Illinois Department of Public Health in the coming weeks about how to either document that or what documentation providers might ask you for. So I would expect to see more of that. Certainly the idea is that not make it overly laborious to prove that you have a condition. The goal is to get everybody vaccinated. But I think as you see more providers moving into that group, there'll be a little bit more information about what exactly to provide. But again, the goal is to get vaccine out as quickly as possible, not to make it as complex or convoluted as possible to prove your status.
Right. One of the questions we have is moderate to severe asthma considered to be a pulmonary condition for phase 1B or C?
Yeah, and there too, I think the language in the IDPH plan just says pulmonary condition. So I think we'll see more examples of those conditions, and also healthcare providers looking to help people make those decisions about whether they should be vaccinated for a particular condition as the vaccine supply goes up. It's hard now because not many providers have it, but as vaccine supply does increase, you should be able to have that conversation with your provider and get a better recommendation.
Okay. And then if someone registers or fills out the form, Karen, for the DuPage County health site, that's not really an appointment. Can you explain what that actually means for people?
Sure. That in essence, how I think about it is that gets you in line for an appointment, right? So you wouldn't get an appointment without getting in line, but it is not your appointment. We have been very concerned about just scheduling people out for the next 6 months because, and really that's been impossible because we don't know how much vaccine we're going to get week to week, and it would be chaotic and even more challenging to then cancel and reschedule appointments. So the only time clinics are opened is when we have vaccine in our hands, so that we can make sure and be able to serve those individuals who are finally getting that call.
Now, Karen, do we know why all of a sudden the dose distribution to DuPage went from 23,000 to 2,000 a week? Or was that just a decision made by the Pritzker administration?
Well, I think it boils down to that's a decision that was made at the Illinois Department of Public Health and at the state level. I think there's several factors. I think the need to provide second doses for individuals. I think the decision to perhaps take more vaccines off the top of the state's allocation and distribute them to pharmacies or to special pods throughout the state are another consideration. And I wish I had a much better logical answer for that, but I simply don't.
Yeah.
Representative Mazzochi.
Sure.
I think it was in the Chicago Tribune this past weekend where a county in Western Illinois was bragging on how they were really taking care of their population. And early in the pandemic, they had a large outbreak. So I'm wondering if that county, maybe Karen may know the answer to this, got extra doses because of that earlier history. Does that play into it at all? Do you know?
It may, but we are not aware, and those criteria have not been shared with us.
One question that I think is, would be useful for people to know is if a business wants to get their employees the vaccine, do you need to go through a separate registration process? Or again, are you just going to have to rely on your existing healthcare or medical provider network?
Take this one. Yeah, so if you're an employer, you're a business owner, we're recommending first that those organizations do work with whatever providers they may have relationships with already to do flu shots or wellness screenings or some other service. If you don't have those services, we are working to connect businesses to providers that are interested in doing on-site clinics or other opportunities. So I think I put in the Q&A, there's a link, and I'll put it in the chat too, to our COVID-19 business team. That we can work with you. But yes, the goal is to try to get vaccine as close to people as possible, whether that's in the doctor's office, at work, at a pharmacy, at the grocery store. All of those can be options.
And Chris, Karen, Dennis, while again, I very much appreciate that DuPage County is really trying to, stick to the priority list in terms of making sure that we've got 60 to 70% vaccinations in 1A, 1B before we start expanding to other groups. What we have seen is that there are groups of people who are, getting vaccinations, whether it's through the pharmacies, through some other sources. Is there any way that I haven't seen it at the state level. The state's not keeping track of who's actually getting vaccinated, right? They're not trying to create their own numbers or tracking system through those other private sector routes that are occurring outside the county.
The state is actually requiring all vaccine providers to enter individual information into the iCare vaccine registry system. And Chris, can you pull up that slide? We were able to actually mine that data again through many negotiations and back and forth with the state of Illinois. We were granted some special permission to get this information. And so what we find is the beginning of a breakdown of who has received a vaccine. And these are residents of DuPage who have received a vaccine, maybe not. They may have received their vaccine outside of the county. And so you see there was one question about Moderna versus Pfizer. You can see the breakdown of those doses. It has been, over the course of these few short weeks, easier to get Pfizer doses versus Moderna because Pfizer requires that ultra cold chain to be maintained, and there's mixing that has to happen. You have to have a diluent and mix the vaccine at the point of the clinic. And so some providers have chosen not to do that. At our clinic, we tend to like that because we can get as many, historically, we've been able to get many more doses than we would have been if we went only with a Moderna. So you'll also see the breakdown of race, ethnicity, although you will see large chunks of that, those categories being either unknown. Well, they're listed as unknown, but clearly people have chosen not to, simply not to answer that. You see a breakdown of the age categories. So you'll see that of DuPage residents, 62.5% of individuals who received the first dose were in that, probably that healthcare professional group, and another 36% 7.5%. We're in the over 65 as we're moving more into that group. You'll see that concerningly females, women are much more apt to have received both their first and second dose than their male counterparts. So I think that will be something that we have to contend with as we go forward. So this was the first glimpse that we had. We're hoping to be able to continue to provide this type of data to the residents of DuPage on our website, but this was the first glimpse that we had.
Got it. Now, Karen, one question. So I know that, because Illinois is bordered, we can get to Indiana within an hour, we can get to Wisconsin within an hour if you're in DuPage County. And I've also heard this from some people in other border counties, that they're actually finding it easier to cross state lines to go get COVID vaccinations. Is that something that's going to get picked up in the iCare website? I'm assuming, or in the iCare submissions, I'm assuming not.
Yes, I would imagine that those providers do not have access to the Illinois system, right?
Okay. Dr. Wilson, I don't want you to not join in the question and answer fun. So one of the questions that we have is, if you were to receive the Johnson & Johnson vaccine and it's only 72% effective, can you receive another vaccine later?
Actually, Johnson & Johnson is doing studies right now with a second vaccine. I think they're recommending that it be done like 8 weeks later, something like that, to see the efficacy. And in England, they're actually giving a dose of one vaccine and the second dose with a different vaccine with a study to see how the efficacy there as well. So right now, studies are ongoing about whether that's possible or if it's a good idea, but it's not presently being recommended.
And I think even with the AstraZeneca vaccine, they were surprised that it actually, it led to better results the longer the delay occurred in between some of the vaccine doses.
That's an interesting thing, isn't it? Yeah,
Yeah.
that delay may, it's hard to, until we get the science together and get all this information, it's hard to know what's going to work out. This is such a new thing. I remember at a Board of Health retreat we had early in 2020, we were talking, we saw this horrible pandemic coming, and I said, now, how soon you think we'll have a vaccine available? They said, oh, a year and a half down the road, maybe. And all of a sudden we've got these vaccines available, but yet we don't have them available, do we? So
Yeah.
there's a lot that we're learning as we go forth.
Yeah, although I will say that as one who's dealt with FDA on the regulatory side for over 20 years, I think that this is probably the fastest I have ever seen them act in my career in terms of really trying to prioritize the reviews on these and get them pushed out the door, which doesn't necessarily mean that the reviews were sloppy. It's just that there really was a dedication made to actually getting things expedited, whether it was through emergency use authorizations or anything else going forward. I think they just did the same thing with the monoclonal antibodies too. So
the FDA really wants them to be trustworthy. So that's the reason why they take as long as they do.
Yes, and I think that's a really important point, Representative, because especially when we were first starting to vaccinate, people were very skeptical because it had happened so quickly. Can we trust these vaccines? And I think it's important to note, without getting into a lot of the science, because honestly, I'd be done very quickly if we did that. But that a lot of the background for the development of these vaccines had been laid. So the foundation had been laid, and the FDA did not skip or not provide one layer of assurance. In fact, as you're saying, it was simply condensed. And so every safety protocol was followed, every trial was followed, and these vaccines have still proven to be phenomenally successful and effective.
Yeah, and I think that, so usually when it comes to clinical trials, you have phase 1, phase 2, phase 3, and there are some drugs that can get on the market with just a phase 2 authorization. But for these vaccines, they all went through phase 3 double-blinded clinical trials, which is considered to be, the gold standard for proof of safety and efficacy. So that is one of the upsides of what went on. And I think the Moderna clinical trials, for example, I think I saw one, profile where they had recruited over 30,000 patients. So it's not as though this has been tested out on just, one small subgroup. And I think that all of the companies have really also tried to make a point of including diverse populations within their clinical trial subset, with the expectation that this is something that's going to need to be rolled out on a worldwide basis. So they wanted to make sure they were covering all the different patient populations. So one of the other questions we have, I'll direct this to you, Dr. Wilson, is the J&J vaccine is not a messenger RNA vaccine. Is that right?
That's correct. That's an easy one. You can keep sending those easy ones my way. Yes, it's that vaccine is a killed virus that's can't cause the disease, but it comes from actually from a virus, not messenger RNA.
Right. And I think that, again, for everyone watching, the main point really for any of these vaccines is to try to trigger that immune response, so that you've got the antibodies kind of in your immunological memory, so that if you do get confronted with a coronavirus in the future, your body's going to be able to respond quickly before we get to the type of situation where you had people with very high viral loads, and then we just didn't have good effective treatment options available, aside from you're on a ventilator, you're on oxygen or something like that. And I also want to give kudos to our medical doctors as well, who have also done amazing innovation work to treat those patients with new drugs and different clinical protocols, so that we do actually have more patients. Even when you get COVID, you're surviving. One of the other questions is DuPage County Health Department accepting registrations from people living outside the county, but still in Illinois. Some other counties have a disclaimer that only county residents will be recognized.
So we in DuPage County, we have announced and really are focusing on DuPage County residents and people who work in DuPage. It is a federal resource, and so there's an acknowledgement that it should be available to everyone. However, since we're using DuPage resources to actually administer the vaccine, we feel entirely able to say we're focusing. Now, if somebody works at a DuPage County hospital, or is a police officer with a department in DuPage but lives outside of the county, we still are providing them with vaccine as well.
One question is, with more long-term care facility residents being vaccinated, when might we be actually able to resume in-person visits with our loved ones? And, I think in that situation, it's again going to be very dependent on the nature of the facility, making sure that everyone actually has gotten vaccinated and has gotten over the window. But I certainly know that talking to long-term care providers in our area, they are extremely excited to get those in-person visits and group dining and all of that reinstated. So I would operate under the assumption, I don't know, Dr. Wilson, what you're hearing is the medical recommendation. So once everyone in a facility were to be vaccinated, assume you have 100% compliance, what's kind of the waiting period that doctors are recommending after you've gotten that second dose?
Wait at least 2 weeks after the second dose. And so I kind of alluded to that in my discussion, that if you have a family or a close community that's all been vaccinated, then you can start gathering. But anytime you go out from there, you still have to put on your mask, do the distancing, all that stuff. But in a closed community where you're sure that everybody's vaccinated, I have an aunt who's a Sister of Charity of Nazareth, and that little community, they have been so cautious. No one from the outside world comes in, and she's so excited that they're getting their second vaccine dose. They're looking forward to doing exactly what you're saying, Representative Mazzochi, getting back together again.
One thing I'll ask is, I know we've got a slide, a lot of people have been asking for the website for the vaccine registration, and other things. I think we've got a slide on it from our office. If we could put that back on the screen in terms of places where you can go. But again, it's dupagehealth.org/COVID-19 vaccine. And the call center number is 630-862-7400 for DuPage County. So again,
just a quick 630-682-7400.
682-7400. That's what I had written down. If I
Yes.
transposed, I apologize. Wouldn't be the first time. Okay, so another question that has come up is, why aren't the vaccination sign-up for the pharmacies being handled and prioritized the same way that the county is handling them and prioritizing them? Unfortunately, the answer to that is I know some states have done that. They've given people the equivalent of a number at the state level, and then wherever you were in the queue in terms of were you a certain age, did you have certain comorbidities, et cetera. For whatever reason, Pritzker administration and the Illinois Department of Public Health elected not to do that. So I think that's why we've just had difficulties in terms of trying to figure out, not only, where can I get registered, but, how long is it really going to take for me? Another question we have is, are employers required to ask for proof of vaccination before employees can return to work? Dennis, I don't know if you've got any insight on that one.
Yeah, go ahead.
No, they're not required to ask for proof of vaccine. Some employers might do that themselves, but they're not required to do that.
And then some providers are asking people to bring their insurance cards to their appointment. If the vaccines are being provided free of charge, what's the rationale behind bringing the insurance cards?
So that is used the vaccine itself is offered at no cost. However, the federal government early on identified that vaccine providers would be able to bill insurance a nominal fee for actually administering the vaccine. And so that is the justification or rationale for that information being requested.
Dr. Wilson, you mentioned earlier that there were some patient populations who have not yet, we don't yet have clinical studies in terms of vaccine efficacy, such as, for example, individuals under the age of 16. Are there any other critical patient populations that you can think of, such as, you mentioned pregnant or lactating women, people who are already immunocompromised, I think were excluded from a lot of the clinical trials. Is there any other type of group that you're aware of that maybe should just, read those labels carefully, or, request that your physician read those labels carefully just to make sure that it's appropriately indicated for you?
Yeah, I think the people that are really highly sensitive to certain allergens, especially anything that might be in the vaccine, should be cautious about getting vaccines right away. People are just who they worry about having that anaphylactic reaction. That's that severe, almost deadly reaction to like bee stings and things like that. So that population should be careful. Okay. But otherwise, you've mentioned the ones that I'd be concerned about. Okay.
So I do want to encourage everyone to, again, we're getting questions fast and furious. So if you could throw in your last round of questions so that I can try to get them answered by our experts if we can't in the next couple of minutes. Again, please do send them into our office. You can reach me at my email address, Mazzochi, M-A-Z-Z-O-C-H-I, at ilhousegop.org, or at the Westmont office, which is 630-852-8633. And again, I'll give you the DuPage County website again. It is dupagehealth.org/COVID-19 vaccine. And the phone number for DuPage County Health Department, 630-682-7400. One of the other questions that we have, this one's interesting, is it possible that those counties who are not opening up right away, whether in 1B, Illinois, might not get as much vaccine from the state as those counties who do open up 1B2? So again, that's an area where we just do not have transparency into how the Pritzker administration and IDPH is doing the allocations each week. Hopefully what will happen is, again, anytime you are making these types of doses, the actual active manufacturing takes several weeks, if not months. So as more supply starts to come online, as more doses, more companies start coming online, and we just have more capital infrastructure that is actually manufacturing these doses. Hopefully we won't have to deal with those kinds of decisions, because I do understand they are extremely distressing to people who desperately want this vaccine and can't plan their lives around when they're going to be able to get it. One of the last things that I did want to touch on, Dr. Wilson alluded to that we were talking about this before the presentation got started, does have to do with the quote unquote mutant strains. And, I do want to caution everyone that, while we certainly don't want to see the COVID-19 virus mutating, viruses mutate all the time. The reason why we have different flu vaccines each year is because the flu virus mutates all the time. There's a whole host, the reason why you can't develop immunity to the common cold is because cold viruses, they are plentiful, they will mutate. And your immune system has basically said, it's not even worth me remembering this particular virus, because I know I'm going to get hit with another one, and it's going to be different. So I know it's very exciting for the media to talk about the South African mutant or the Brazilian mutant, et cetera. But one of the things that we do know about the COVID virus is that it's the spike protein that is what really makes it accessible to your cells through what's called the ACE2 inhibitor and inhibitor protein. And all of these vaccines are being targeted towards that spike protein. So the fact that, maybe the J&J, you're getting about 70% efficacy, some of the other ones you're getting 80 or 90% efficacy, it's still priming your immune system to recognize that critical viral protein. So, and if the spike protein were to mutate away and disappear, the coronavirus wouldn't be able to even get into your cells as effectively as it does. So I do want to just, hope that everyone isn't going to, again, I think following Dr. Wilson's advice, certainly we want to take care that we're not spreading the virus. We don't want, the virus to get into a mutation point where it's even more deadly. I think that over time, as we start seeing how all these different vaccines react with one another and how they work, we may very well get to a situation that we've gotten to with other viral drugs, whether it's HIV or tuberculosis, where we figure out that maybe there's a particular cocktail of different options that really, offers the best route to overall viral suppression. But that is something that I know a lot of people have been really worried about. And until we actually have a point where clinically, it's being very terrifying. I think as long as everyone just maintains general good practice, we should, it's not as though it's going to be, a massive panic unless, again, there's some random mutation that genuinely makes the virus worse. And to date, they've just identified different strains.
It's one of the reasons I'm glad you're my representative. You're such a smart scientist as well as a smart woman. So
I do love my science and genetics.
Yeah,
so
it shows. You do it well.
All right. So I do want to make sure that we get to these last few comments. Let's see. Okay, I think we caught that one. We caught that one. Yep, we got those. We got those. All right, I'm going to do the last round on the Q&A. I think we got those as well. And let's see. the pharmacies are handling 2 different vaccine allocations, the government and the DuPage County Health Department. So yeah, I do want to reiterate that there are people, and Karen, I don't know if you want to close on this. There's a whole host of different distribution networks. There's the federal government at the CARES through the CARES process, and they are, I think, primarily focusing on CVS, Walgreens, other locations. There's the Illinois iCares program, which has its own set of preferred providers, and DuPage County is also working with its own providers. So Karen, I'll let you finish that one out.
Sure. So absolutely, it does appear that pharmacies may be getting from 2 sources or have gotten from 2 sources. Unfortunately, again, it's one of those that we don't have a lot of transparency into how much, which is why I encourage everybody. Yes, it takes time, but check with every pharmacy, get on every list you possibly can. And it doesn't matter where you get the vaccine is the vaccine. So please take advantage of the first opportunity.
Yeah, I would want to second that one. If you do actually get a window where you can actually get vaccinated, take it. And again, even if you say, well, maybe, I get the first one, but I might not be able to plan for the second one, even that first dose is going to provide some protective efficacy, even in the 2-dose regimen. So I definitely wouldn't delay if you get that opportunity to get vaccinated, and you're in the 1A, 1B category in particular. All right. One other question, check with the long-term care facilities to see what percentage of their staff agreed to the vaccine. Unfortunately, I do know that some staff at long-term care facilities are not taking the vaccine at the same rate as some of the residents, unfortunately. And where we go from there on that is going to be that could be a whole other separate webinar and talk for discussion. But again, I do want to, thank you so much to all of our wonderful panelists this evening. To those of you who are watching from home, we're also going to have this available on both my website, repmazzochi.com. You can also get a copy of the link to the webinar if you email my office, so mazzochi@ilgop.org. And please feel free to share this link with so many others, because we do know there's a lot of misinformation out there, and we do want to try to get you as much accurate information in real time as possible. So thank you, Dr. Wilson. Thank you, Karen Ayala and Dennis Brennan from the DuPage County Health Department, and Chris Hoff, who has been our master of ceremonies in the back and also providing information. And we look forward to providing more of these types of programs for you soon. Just so you know, next week our programming is going to be related to the opioid abuse situation. Unfortunately, with COVID-19, we have seen a tragic increase in opioid use and deaths in DuPage County. So we're going to do some additional programming so that people know what resources are available to you and places where you can go and signs to watch out for. So again, thank you very much, everyone. I really appreciate your time. Have a great evening.
You as well. Thank you so much.
Thank you.